took it from down here. Yeah, that's what I'm going to do.
People want to see.
Yeah, man.
Look, I'm picturing that video.
La vue, c'est quand il pense non. You don't get like all the time. You don't get image.
Is it where
Yeah. You know what I'm saying? Yeah, when it comes to get shit, we come around, you don't get that shit. But when you don't get that, you're that.
Oh yeah, alright.
Yeah, you're better. Yeah, I'm good.
But the man won't give me chance. Black me. Let me see, standing on the road and here's how you do it. Sorry.
welcome everybody to this wonderful program today. Can we all be on our feet as the band lead us to sing the national anthem? Please let's be seated. To kick things off, we start with a welcome remark and introduction by the Secretary General of LCPS. With a round of applause, please welcome with me Dr. Janetta K. Johnson.
Mr. MC, we heard that you did a fantastic job at the launching program of the Pediatrics Association. So don't be surprised when we nominate you as the official MC for LCPS. So thank you. I'm happy to welcome all of you to the Liberia College of Physicians and Surgeons 6th Convocation and Annual General and Scientific Meeting. On behalf of the President and Council members, I thank all of you for joining us today. We are grateful to our faculty, our residents, our training institutions, the government of Liberia, our many partners, and other stakeholders, all of whom are critical to our success. We are lucky to be using this beautiful venue for the second year in a row, but it will be even better if maybe Honorable Minister, Honorable President, Executive Council, our partners at WACS, WACP, it will be even better if maybe 3 to 5 years down the road, and I'm sure we'll get all of the support from our Chair of Health in the House of Representatives, if we are able to hold such occasion at LCPS's own medical complex. The Annual General and Scientific Meeting is a statutory meeting of the college held during the second half of the academic year. All fellows and members of the college are required to attend. So we are holding our 6th AGSM and Convocation since we were established in 2012. We had our scientific session part 1 this morning. This section now is the opening program. Tomorrow, Saturday morning, we'll continue with part 2 of our scientific session. And in the afternoon, we'll have our annual general meeting. During that time, we will deliberate on issues of the college. The president and all principal officers serving in positions of responsibility will report on the stewardship relating to the affairs of the college. We are pleased that the Honorable Minister of Health, the chair of the House Health Committee, other officials of government, members of the diplomatic corps, head and members of international development agencies, particularly USAID, who has been following us and made sure he was going to be with us today. So welcome. Heads of our sister colleges, I'm especially thankful to the president of the West African College of Surgeons, who promised that he would have been here today. And as we're expecting him, for some unforeseen circumstance, he couldn't make it. But he didn't rest there, only sending in an excuse. He made sure that WACP was ably represented by the Vice President and the Honorable Treasurer. So welcome to our meeting. We are also pleased that our council members are joining us. Our training institutions, they are all here. Our members, our fellows, our graduates, and their families are gracing this occasion. And this year, this program is unique because for the first time, we will also be honoring someone who has made sacrificial services to the growth and development of mental health in Liberia. Our honorary fellowship will be bestowed upon Dr. David Carlton Henderson of the Boston Medical Center. So welcome to you and your team. We are also pleased to have Mrs. Abraham Baba with us today. I think it's her first time joining us for this lecture series. So we want to welcome you wholeheartedly. I know Dr. Poto is happy because he was one of the instrumental in us launching a series. So I'm happy that the local chapter of WACP, WACS, they are all with us today. And for our program, we have goodwill messages from our sister colleges, WHO, USAID, the World Bank. After that, we have a statement by LCPS President. We have an introduction of the Abraham Baba lecturer. And this year, we are pleased to have our own Dr. Lawrence Momo Sherman, who will be delivering that message. Welcome, Dr. Sherman. Then the critical part of the program, I know that the graduates, the honorees, and the families and friends will be waiting for the admission of 2022 members, fellows by election, and honorary fellow. We have our faculty chairs, the Vice President, and our President conducting that admission ceremony. Then our faithful ALWOT Assembly, they are here to just render a beautiful selection, so we know we can always count on you. So welcome. We have special remarks by Dr. Jerry F. Brown, who will be represented by Madam Dama Kofa, and Dr. Brown will be speaking, his representative will be speaking on behalf of all of the training institutions. Then we have a special remark by Dr. David C. Henderson. And then last but not the least, my own sister and friend, Dr. Wilhelmina S. Jala, Minister of Health, Republic of Liberia. So Dr. Poto, the only person missing, I would say, from the past leadership, Dr. Marshall. If Dr. Marshall was in country, she would have been here. Then of course I would say this would have been a milestone to have all three of our past presidents together. But let's shoot for next year. So maybe next year we'll have all of them together and see how we can continue to strengthen the relationship between WACP, WACS, and LCPS. So once more, on behalf of LCPS, we welcome all of you. Thank you very much.
Thank you, ma'am. While the remarks from the representatives of the various colleges are going on here, the goodwill messages that were sent in by the presidents of the sister colleges will be on display on the screen, so you can just be looking at that too, because I don't want us to do it separately before we spend too much time. So I will call on the representative of the West African College of Surgeons to please come and deliver their goodwill message. A round of applause, please.
The President, Liberia College of Surgeons and Physicians, the Honorable Minister of Health of Republic of Liberia, Dr. Jani. May I stand on all established existing protocol. I bring you felicitations from Professor Peter Duncan, who is the President of the West African College of Surgeons. On behalf of the Council and Fellows of the West African College of Surgeons, he sends his greetings. It's actually, as the Secretary has mentioned, that this is a promise that he has sent me to keep. Bearing in mind that by next year, I'll be the person liaising with your president and moving on with the collaboration between our college and the Liberia College of Physicians and Surgeons. So it's my pleasure to represent him here and bring you his message. The West African College of Surgeons rejoices with Liberian people and the Liberian College of Physicians and Surgeons on this 6th convocation ceremony and annual general scientific meeting, during which we expect that young fellows of the college will be inducted. We share the vision of the Liberian College of Surgeons and Physicians in doing all they can within their purview to advance and provide the surgical and medical manpower need of people of Liberia. We appreciate the enormous challenges facing a young college like yours. We passed through a similar experience where most of the countries in West Africa were just coming out of colonial rule. At that time, we took the bull by the horn and championed the local training of surgical manpower needs in West African sub-region. Today, we can boast of the largest collection of surgeons in any college in Africa. And we believe that the Liberian College has a lot to learn and leverage on the experiences and opportunities we provide to them for collaboration. Our college provided leadership for all the colleges and nations in West Africa in the evaluation and drafting of the surgical, obstetric, and anesthesia manpower. Having worked on that program, we have made these templates available to institutions for them to use it to be able to develop their own surgical, obstetric, and anesthesia needs. And on this regard, I doff my hat to our fellows here among you, both from the Physicians College and the Surgeons College of West Africa, who have been serving the people of Liberia, helping to meet these needs in surgery, in anesthesia, in obstetrics, in every aspect of surgery. We thank you for extending this program we've done and being able to implement it live among the people of Liberia. We appreciate the need of the less endowed nations like Liberia to upgrade the training of surgeons, to have specialists ready to get into the field of work within the shortest possible time. However, these soldiers need to be properly trained and be capable of handling the day-to-day solid duties of people of Liberia. This notion was in our mind when we created the membership program of our college. We believe today, if you go to a country like Ghana, all the program surgical needs at the rural centers, at the district hospitals are manned by this kind of surgeons. We believe that Liberia has a lot to gain and benefit from that mid-level manpower training. There is nothing more rewarding and lucrative in manpower training than when this training is done within country of the trainee. We have strived to provide this opportunity for people of Liberia through accreditation of their training institutions to enable them to train. We will remain focused on this accreditation of any center in Liberia where we think any meaningful form of training can go on. We will use all available and every available institution and facility in Liberia to train. Our college is equally willing to receive fellows and residents of Liberia and Liberia College of Physicians and Surgeons to give them opportunity to train within our facilities, accredited facilities in the sub-region. Today, some of your fellows, some of your trainees are making rotations in other countries in West Africa, and we are able to facilitate that. In this regard, we extend our thanks to organizations like Kids OR, the Smile Train, and Second Chance, whose funding has made such extension possible. And we believe there's a lot more that both of our college and your college can do to be sure that every trainee in Liberia has the opportunity to get firsthand the best training that is possible. To the new graduates, we say a huge congratulations to you on this wonderful achievement. Your work is cut out for you because we know that the harvest is plenty, but the laborers are few. You are among the privileged few in this country, and your country needs you not only to relieve the sufferings of the people, but also to be good role models to the ones coming after you. We plead with you, do not disappoint us. Mr. President, thank you for inviting us to this your joyous celebration. We wish you a fruitful deliberation. Thank you.
Thank you so much, sir. To bring the goodwill message on behalf of the West African College of Physicians, I call on Dr. Angela Benson. A round of applause, please.
Okay. Professor Benjamin Harris, President, the Liberian College of Physicians and Surgeons, the Honorable Minister of Health, Dr. Wilhelmina Jala. Please allow me to stand on the existing protocol. I stand here on behalf of the West African College of Physicians and on behalf of the President, Professor Duro Samin List, and also our President-elect, who is our own Dr. Rose Jala Macaulay, and the Liberian chapter, of which I am the current chairperson. I'd like to congratulate the Liberian College of Physicians and Surgeons for this landmark on your 6th annual general and scientific meeting, as well as the 6th convocation. We are happy to note that each year we have more and more doctors who are graduating as physicians as well as surgeons, trained on our own soil and able to competently, individually attend to complicated cases without us having to refer them to other neighboring countries or outside the country, especially for our people whom we know do not have the means to travel and to be able to be exposed to all these other complications and for all the other treatment. We are happy that we can do now confidently say we have a large pool in country who can manage such complicated cases. So congratulations, LCPS, and congratulations to the work that has been done so far. I know that it has not been easy as a young college going through all of the obstacles and issues that has to do with the existing economic situation globally and in country. But despite it all, we are still able to shine and show forth these graduates. So we are very happy on behalf of my bosses from the West African College of Physicians, and to say that this year, in particular, our annual general conference will be held in Accra, Ghana, from the 31st of October to the 2nd of November. And we hope that you all can join us there, as many as possible, since we are carrying our president-elect. But we are happy as we see more and more graduates, and we hope that in the coming years, the colleges that are not yet established will come forth and be established so that we can even have more faculties than we're having now. So congratulations, Mr. President. Congratulations to the graduates. Thank you.
Thank you, ma'am. On behalf of our sister college in Nigeria, the National Postgraduate Medical Council of Nigeria, I call on Professor Thomas U. Agan to please come and give the goodwill message. A round of applause, please.
Thank you, Mr. MC. The presidents of the Liberian College of Physicians and Surgeons, Professor Harris, all officers of the college, I want to take a special recognition of my ambassador, His Excellency, Ambassador Godfrey Odidibu, who is right here himself. I bring you warm greetings on behalf of my president of the Nigerian College of the National Postgraduate College of Nigeria, Professor Aki Oshibogu, who is unavoidably absent because of other exigencies. He would have been here, but unfortunately he couldn't come. He whispered that I should say a word on his behalf because I am a fellow of that college and we are CEOs at the same time. I want to congratulate the president and the entire college for this great job. Establishing this college is not an easy, and to run it is not an easy thing. Training takes a lot, and the college has done so much by producing so many graduates and fellows. Congratulations, sir. Now, the thing now is competency-based training, which the College of Physicians and Surgeons in Liberia would adopt soon. Because that is the collaboration the National Postgraduate Medical College of Nigeria and the West African College of Surgeons have gone into, and is coming very efficient. And we pray that we, the teachers, will key into this option of training our residents, training our graduates to get that competency-based training which LCPS is doing very well. And I want to say thank you on behalf of Professor Shibogu and the entire National Postgraduate College of Nigeria, and pray that we work hard and bring up this young generation to take care of the healthcare of Liberia, to take care of the coming generation. Thank you, and God bless us all.
Thank you, Prof. I feel massively protected that the ambassador from Nigeria is here, so a round of applause again for the Nigerian ambassador. All right, we move to the representative for World Health Organization. A round of applause for her, please. And I want the representative for USAID and World Bank to get ready subsequently.
Thank you very much. With your permission, I would like to stand on the protocols already expressed and accepted. I bring you warm and hearty greetings from the WHO office in Liberia, manned by its representative, Dr. Clement Peter, who would have loved to have been here in person, but because of competing official priorities, he could not make it. So the WHO Goodwill Message is mainly focused on the WHO's position when it comes to healthcare innovations and how it welcomes the LCPS's initiative to embark on this noble approach to improving healthcare access. So I'll begin with a quote from the WHO Director General, which says, "The WHO Innovation in Health approach is our commitment to work in new ways with our member states, such as Liberia, the workforce and partners, and leverage our respective strengths to find the most impactful, innovative solutions and bring them to the people that need them the most." So WHO is calling on everyone to join so that we all get to work. This is from the WHO Director General. The approach that WHO has to healthcare innovations is based on two major strategic objectives. The first one is going to scale and sustaining innovations for impact, where WHO promotes multi-sectorial partnerships aimed at linking human health demands in country with ready-to-scale innovations. And the second one is on WHO's capability and call to harness a culture of innovation in the WHO member countries. So at today's auspicious occasion, WHO extends hearty congratulations to the LCPS and encourages the movement en masse by LCPS in support of this noble approach in using innovations to achieve optimal healthcare in Liberia. Furthermore, broadening the consultations on healthcare innovations to leverage the strength of local partnerships with multi-sectorial partners, civil society, and the private sector will provide immense boost to achieving the goal of improved healthcare access and services through appropriate innovations. A typical example of what would be my appropriate innovation is the solarization of some of the hospitals in providing healthcare services to the population as far as it's able to do so. So we'd like to say congratulations to LCPS for this initiative. And also warm congratulations to the graduates, and WHO stand by to partner with you in this drive. Thank you for your attention.
Thank you, ma'am. I call on the representative for USAID, Mr. Jim Wright. A round of applause, please.
Honorable Joseph Sonwari, Chair, Health Committee of the House of Representatives. Wilhelmina Jala, Minister of Health. Professor Benjamin Harris, President LCPS. Other officials, fellows, and members of LCPS. Distinguished ladies and gentlemen. It gives me great pleasure to join you today for the 6th Annual General and Scientific Meeting of the Liberia College of Physicians and Surgeons. A strong and resilient health sector requires many things: adequate facilities, essential equipment, and safe and effective drugs. But above all, it requires a highly skilled workforce, healthcare professionals who are at the very center of the healthcare system, providing the critical services to promote health, prevent diseases, and deliver care to these individuals, families, and communities. As we gather here together for the LCPS annual meeting, it is fitting that we congratulate the healthcare professionals, the nurses, physician's assistants, midwives, and above all, the medical doctors, the physicians and surgeons who are responsible for providing care to the people of Liberia. Your numbers are few, although more than they were a few years ago. You deserve better incentives. You often work under very difficult circumstances with limited resources. Yet, day in and day out, across Liberia, you work to heal the sick, care for the wounded, make life-saving decisions, provide advice on how to live healthy lives. Please know that your work does not go unnoticed. We recently had the great pleasure of sharing with our USAID colleagues in Washington, D.C., and with Congress the good news that Liberia has attained a WHO goal of vaccinating 70% of its population against COVID-19, becoming just about the first African country to do so. While the United States contributed to this effort with vaccine donations, we made it clear that the people most responsible for this Liberian success story are Liberians themselves, particularly the healthcare professionals, those gathered here today. We at USAID remain committed to supporting your efforts to provide the Liberian people access to quality care. We will continue to work through our government-to-government health partnership mechanism to strengthen the capacity of county health teams, helping to provide medical doctors and other healthcare professionals the resources they need to do their jobs and improve the conditions under which they work. In fact, I should note that thanks to the great work of the various county health teams, USAID Liberia recently won a collaborative learning and adapting competition that involved USAID missions from around the world. USAID Liberia won because of, among other things, its decision to use county health teams rather than international non-government organizations to provide care at the county level. After performance evaluations and costing studies showed the county health teams not only had the capacity to provide the same services provided by international NGOs, but could do so at far lower cost than the international organizations. All county health teams in the entire Liberia health sector deserve our congratulations for this achievement. Let me also note that through our Partnership for Enhanced Engagement in Research project, known as PEER, the PEER activity through that we will continue to support specialized training for medical doctors, strengthen the clinical and research capacity of medical students and the medical faculty at the University of Liberia. We encourage all our partners, including our Government of Liberia partners, to give Liberia's medical professionals the support they need to succeed in providing the Liberian people the health care they need and rightly deserve. Congratulations to the LCPS as you meet for your 6th Annual General and Scientific Meeting. And we look forward to continue working with all of you to provide Liberian medical doctors the specialized training they need to better serve the Liberian people. Let me close by once again congratulating and thanking Liberia's medical doctors for the work they do, and leave you with this African proverb, which I think speaks volumes about why we should give them all the support they need. Because if you are not too smart to pay the doctor, you better be too smart not to get ill. Thank you very much.
Thank you very much, sir. And I like that powerful quote that if you are not smart enough to pay the doctor, then you're smart enough not to get ill. Which is just paraphrasing the statement, doctors, wake up, collegium. All right, finally, I want to call on the representative that will be speaking on behalf of World Bank, Honorable Matthew Flomo. Please, a round of applause for him.
Let me use this opportunity to say all protocol observed. For correction, I'm not a staff of the World Bank. I'm actually the project manager for the World Bank Health portfolio at the Ministry of Health, where I serve under Dr. Wilhelmina Jala, the Minister of Health, Republic of Liberia. However, let me clarify that we have an association with the LCPS. We provide support through many of the World Bank projects at the Ministry of Health. For the past 6 years, the World Bank project through what we call the Ebola Emergency Response Project has been providing support to the LCPS in the tune of over $8 million. And we also provided support to the LCPS on what we call the health system project in the tune of $11 million. So from 2016 to date, the World Bank, through 2 of its projects at the Ministry of Health, provided over $12 million to both the AMD and the LCPS. And we now have another new project that was just approved yesterday or 2 days ago. And the project has an allocation that will also contribute to faculty and faculty support at the LCPS for the next few years. So let me say that I'm not the staff of the World Bank. It's important I say this. I only manage the World Bank project and the Ministry of Health, Republic of Liberia. Thank you.
Thank you very much, sir. And I like that he clarified that he's not a staff of World Bank, because I was already thinking of approaching him for a loan, you know. Okay, so I will also give goodwill message, and this one will be on behalf of the various spouses of the graduates today. Let's give them a round of applause. Because they have been the one coping with nights when you are not at home, days when they can't see you and they have to practically take care of the kids alone and all of that. And
they deserve a lot of love. Before I call on the President, I would also like to make this comment that two things tells you that you are becoming a specialist. The first one is that you suddenly start finding medical students annoying. Because they come, they sound like they don't know anything. And they feel they know something, you know. And the second one is that your friends that are not doctors start complaining that you are beginning to sound weird, you know. For instance, when your wife is going to the market, you can tell her, okay, this weekend, when you go to the cow factory, I want you to buy cruciate ligaments and disabled bone. So when that happens, please just bear with us. We're still talking meat, everything is meat. Please welcome with me the president of LCPS, my own boss, Professor Benjamin L. Harris.
Thank you, Dr. General. Today I'll say Dr. OG, because everybody calls him OG, even the patients, OG. Madam Minister of Health, Honorable Willoughby Njala, other government officials here present, especially the chair on health at the House of Representatives, the Honorable Joseph Sanwarbi, distinguished members of the Diplomatic Corps, including the Honorable Ambassador of the Federal Republic of Nigeria and the Ambassador of the United States, represented by the Director of USAID, heads and members of international development agencies, Dr.